providing privacy. My name is Brandy, hand hygiene. I'll be doing your assessment today. I'll be doing a head to chest assessment. Is that okay with you? It should take no more than 20 minutes, but it should take a lot less time than that, if that's okay with you. I want to start with identifying who you are. Can you tell me your name and date of birth?
My name is Antoine McKay and my birthday is 04/06/6.
Okay. Are you having any do you have any allergies? Are you having any pain? Okay. So then I'm doing your general appearance. And according to me looking at you, I see no sign of acute distress. Do you know what time it is? You know what day it is? Okay, and by him answering my questions, he's alert to, do you know why you're here? Okay, so patient is alert and oriented ×4 to person, place, time, and situation. His mood and facial expression seems appropriate for the situation of this assessment. And his speech seems clear as he responds to my questions. So now I'm going to move to your skin and nails. Is it okay for me to touch you? Okay, so can you hold your arms out? I'm palpating for temperature, and he seems to be warm to touch, normal warmth. And I'm looking at his nails. No signs of clubbing. I'm doing capillary refill, 1 to 2 seconds. Capillary refill is perfect. His nails are pink and appropriate to race. And his skin color is appropriate to race. So I'm looking at his skin and I don't see any wounds or lesions that's apparent to me. Have you had any recent surgeries where you might have an incision?
No.
Okay, so no incisions noted. So now I'm gonna do your head, neck, and face. I have to touch you again. Is that okay with you? So I'm inspecting for any lesions in his head. None noted. And no signs of infestation. His facial structures are symmetrical. And I'm gonna move on to your eyes. Okay? So could you check for me? Can you pull down on your bottom eyelids? His sclera is pink of normal color. I see no redness and I see no discharge. You can let go, honey. His sclera is white. So now I'm gonna check his pupils. His pupils are of normal equal size of 3 millimeters. So according to Perla, his pupils are equal, brown, reactive, and accommodating to light. Okay, so I'm gonna move on to your ears. I'm just gonna look at both ears. No sign of discharge. And based on conversation, I can say you can hear pretty good. Do you have any difficulty with hearing? Okay, thank you. Okay, now I'm gonna look at your nose. And if you mind tilting your head back, I'm gonna look at your nose. No sign of deformities. Septum seems to be in place. No sign of discharge. No redness, inflammation, or swelling. And if you could do me a favor, can you close one side of your nose and take a breath in and out? And can you do it the other side? Okay, patency seems to be equal bilaterally. Okay. I'm gonna look at your mouth and throat. We're not gonna put a tongue disperser in, but if you can open your mouth and say ah for me. Ah. Lips, tongues, and gum is pink and moist as normal, so no noted deformities or anything going on with his mouth, tongue, and gums. Okay, so now I'm gonna move on to your respiratory, okay? And by just looking at you normally breathing, you're not using any accessory muscles, and I'm gonna listen to you. Is that okay with you? So I'm gonna place my stethoscope on. Okay. In the Z pattern, I'm gonna osculate over his shirt only for the purpose of this video, but normally it would be skinned straight to my stethoscope. So, right upper lung, take a deep breath in and out. Left upper lung, in and out. Right middle lung. This is the left upper lung still. Right lower lung. Left lower lung. Okay. If you could turn around for me, I would like to do the back of your nose. Okay, in a Z pattern, I'm gonna do the same. Right upper lung. Take a deep breath in and out. Left upper lung. Left middle lung. Right. Okay, thank you. And can you turn back around for me? Okay. And next I'm gonna do self-identifier break. Lung sounds are equal posterior and anterior, they're bilaterally. And now I'm gonna move on to the cardiovascular sounds. So again, I'm gonna be listening to you with my stethoscope, if that's okay with you.
Mm-hmm.
Okay, so with the diaphragm of my stethoscope, I'm gonna start with his aortic valve, which is his right sternal border intercostal space. And then for pulmonic, I'm gonna move over to his left sternal border intercostal space. Third intercostal space, I'm gonna listen to the Erb's point. And then I'm gonna move down to his tricuspid valve in his fourth intercostal space. And then I'm gonna move over to his mid-clavicular for his mitral valve. And I'm gonna auscultate with the bell in the same exact points. So, no signs of murmur, rhythm sounds normal. I'm gonna palpate your parotid. Parotid is padding on both sides, equal. Can I check your radial pulse, please? Okay. Radial pulses are normal in a regular rhythm. I will assess for his JVD, which I will have him lay down at a 45-degree angle. I will look for jugular distension, but right now I don't see any sign of that. So then, and I'm moving on to the closure. So I want to thank you for allowing me to assess you. Are you having any pain before I leave? No. I'm going to hand you your call light. I'm going to put your bed to the lowest position, locked. I'm going to put your bed rails up. Thank you again. Hand hygiene, and I'm out.